Hello, in this video, I will try to give you usage information about the ZANAFLEX drug. If the video is useful to you, please like the video and subscribe to the channel for support. ZANAFLEX, which is included in the classification of muscle structure system changes, is offered in 2, 4 and 6 mg capsules. The active ingredient of ZANAFLEX is Tizanidine. What is ZANAFLEX and what does it do? ZANAFLEX is a short-acting muscle relaxer. It works by blocking nerve impulses that are sent to your brain. ZANAFLEX is used to treat spasticity associated with diseases like multiple sclerosis and spinal cord injuries by temporarily relaxing muscle tone. How to use ZANAFLEX? Take ZANAFLEX exactly as it was prescribed for you. Take this medication by mouth as directed by your doctor, usually every 6 to 8 hours. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Do not take more than 36 mg a day or more than 3 doses in a 24-hour period. You may take ZANAFLEX with or without food, but take it the same way each time. Switching between taking Tizanidine with food and taking it without food can make the medicine less effective or cause increased side effects. How long does Tizanidine stay in your system? The maximum effect of Tizanidine occurs about 1 hour to 2 hours after taking a dose. It wears off in about 3 to 6 hours after taking it. Tizanidine is typically given no more than 3 times a day. Things to know before using ZANAFLEX are: before taking Tizanidine, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history, especially of low blood pressure, kidney disease, liver disease. ZANAFLEX can cause side effects such as dizziness or drowsiness. Therefore, it's important to understand how it affects you before driving or operating hazardous machinery. Alcohol can increase the side effects of ZANAFLEX. Be cautious when consuming alcohol while using ZANAFLEX. ZANAFLEX may interact with certain medications, so it's important to consult your doctor before using any prescription drugs, vitamins, or herbal supplements. What are the side effects of ZANAFLEX? Common ZANAFLEX side effects may include drowsiness, dizziness, weakness, dry mouth, feeling nervous, blurred vision, flu-like symptoms, abnormal liver function tests, runny nose, sore throat, urination problems, painful urination, vomiting, constipation, or uncontrolled muscle movements. If this video was useful for you, to support my channel, like the video and subscribe to the channel. Share your opinions and experiences in the comments section. I wish you healthy days.